My name is Christina Hanson, and I'm a nurse practitioner. And I'm going to be talking about patient counseling, what to tell your patients about this obeticholic acid transition. The main focus of this podcast is empathetic communication strategies to help APPs explain the withdrawal to patients, address their fears, and build trust in the new treatment plan. And I'm going to break this down into a few topics. First of all, this idea of building trust with our patients and being transparent about this transition. So I think we can all agree that this FDA withdrawal can create a lot of anxiety in our patients, especially those that have been doing really well on obeticholic acid. And so we want to be able to acknowledge our patients' fears and anxiety, what's going to happen when we withdraw Ocaliva, the fear of relapse and symptoms returning, and potential frustration. So in a sense, we want to normalize this emotional response. Talking to our patients about it's normal to feel angry, it's normal to have anxiety or feel anxious about losing a treatment that has been working for you. Explaining the why, I think, is really important as well. So this transparency, our patients should understand what was behind this FDA withdrawal. So these are regulatory or safety mandates. So explaining that a little bit more to our patients in a concise way. We're going to have some patients that want to nerd out a little bit more than others, but I would probably approach it by explaining, first of all, that there were some patients that were found to have liver failure with Ocaliva that did not have cirrhosis. In addition, the long-term trial, the COBALT study, failed to demonstrate that obeticholic acid actually improved long-term liver-related outcomes. So that, coupled with some of the safety concerns the FDA requested for withdrawal, was really based on that reevaluation of the drug's risk-benefit profile. So again, explaining that to our patients. I think some of our patients, rightly so, will also have questions around any exposure to obeticholic acid and what that looks like for them. Is there some concern about having taken it at any point? And I think reassuring them about, again, what the COBALT showed, those few patients that had these reactions, there is no data around or concern around any exposure to obeticholic acid going forward in the future. So again, providing that reassurance for them. And then being able to pivot then to this new kind of patient-centered treatment plan. So that brings me up to the second point that I want to talk about is just that shared decision-making, shared autonomy really about where we're going to go from here once we take our patients off obeticholic acid. So clearly outlining that pharmacological strategy. So what does that look like? It's going to vary from practice to practice, but how we're going to stop the obeticholic acid and transition to a new therapy. And I think that is looking at our patients and what their goals are as well as ours. Obviously, we know that when we take away that second-line therapy, eventually those biochemical markers are going to worsen again. They're going to relapse. So reassuring them that there are new therapies and multiple therapies available, talking about those treatments, those medications, the mechanism of action, how they work, the safety profile of each of these medications and the efficacy, and really a shared decision-making approach. We do understand from data that these PPAR medications can have some additional benefit when it comes to some of the symptoms that go with PBC, including fatigue and pruritus. So introducing that to our patients as well and understanding which patient may have a goal related to that. And then going from there as far as making a treatment choice. So again, clearly outlining what that's going to look like and helping that patient feel optimistic around their ability to be empowered in this choice as well. And then my third topic or focus of this podcast is really looking towards that long-term success with our patients, helping them kind of reorient, if you will, from the loss of that medication, Ocaliva, to what the positive outcomes can be with these new therapies. So using some open-ended questions for our patients. What are the 2 or 3 things that when they were on obeticholic acid that were important to them. What are their goals going forward? And helping them to articulate that, again, in that shared decision-making platform, and really empowering them to be a part of this transition so it reduces that negativity around it. So in the end, the discussion will certainly vary from patient to patient, but providing reassurance, explaining the why, that transparency of the decision, and educating our patients on the alternative therapies with a shared decision-making approach is really key in empowering them to feel confident in this transition. Thank you.